Good afternoon. My name is Ramses.Vasquez.Pineda and I am 23 years old. I hail from the city of Oaxaca de Juarez, Oaxaca, and currently I am an 8th semester student pursuing a degree in medicine and surgery at the Universidad Anáhuac, Oaxaca. I am drawn to the U.S. Clerkships and Internships program for several reasons. As a member of the student committee of bioethics, I have developed a profound interest in ethical considerations within the medical field. Investigating the paramount importance of bioethical issues, particularly in clinical practice, has fueled my eagerness to be part of a program that upholds the standards of excellence in medical care. Moreover, I am deeply passionate about scientific research and the development of scholarly articles. The opportunity to engage in hands-on clinical experiences alongside esteemed medical professionals aligns perfectly with my aspirations to contribute meaningfully to the advancement of medical knowledge. Being part of this program will not only expand my clinical skills, but also provide a fertile ground for the cultivation of innovative ideas and the creation of impactful scientific publications. Now, allow me to share with you an intriguing case from one of my clinical rotations, specifically during my gastroenterology rotation. We documented the journey of a 24-year-old female patient with a history of 3 episodes of hemorrhage. The first occurred at the age of 4, followed by another at 8 years old, and her third event at 13 led her to a hemorrhoidectomy due to transitional bleeding, resulting in hypovolemic shock, which was managed medically. Subsequent examinations revealed multi-organ lesions, predominantly in the colon, the liver, lateral aspect of the vagina, and vulva, with a torpid evolution. Let's make an overview of the diagnostic procedures conducted during her management. The colonoscopy showed a mixed hemorrhoidal disease with signs of recent bleeding in the internal component, suspected arteriovenous malformations in the sigmoid and rectum without signs of recent or active bleeding. At the EKG, we found a sinus bradycardia with a heart rate of 50 beats per minute, without evidence of injury or ischemia. Immunological tests showed negative anti-DNA, negative anti-RO, anti-SM, ANAS, lupus, anticoagulant, and anticardiolipin antibodies. The C3 level showed a 70 mg per deciliter rolling out of lupus. The ultrasound showed a minimal hygrometra, scant fluid adjacent to the cervix and vaginal roof with a minimal subhepatic posterior fluid. The hepatic ultrasound showed an hyperechoic lesion in segment 5, suggestive of hepatic hemangioma. The thorax CT showed a slight bilateral peribronchovascular thickening, vascular component, bilateral pleural effusion associated with a passive atelectasis, predominantly on the left side. The abdominopelvic CT showed an anomalous vascular tract with increased caliber and tortuous course, visible in arterial phase at segments 2, 3, and 5 of the liver, notably around lobulated engaging lesion in segment 5. The 3D reconstruction showed the vascular component originating from the hepatic artery, with tortuous dilated vessels around the lower uterus and rectum. At the discussion, visual involvement, particularly in the liver, carries a poor prognosis. However, in this clinical case, the patient presented with involvement in the sigmoid colon, vulva, and lateral aspect of the vagina, making the clinical manifestation even more peculiar. Typical asymptomatic common clinical findings include hepatomegaly, congestive heart failure, secondary anemia, and thrombocytopenia, and jaundice due to portal vein obstruction. The patient presented with transitional bleeding, leading to initiation of the diagnostic protocols to determine the origin and tailor treatment to her clinical presentations. At the conclusion, the diagnosis was concluded as multiple hemangiomatosis, leading to a referral to tertiary center for evaluation of selective arterial embolization by interventional radiology, followed by multidisciplinary surgical intervention as colorectal surgery, vascular assessment, and gynecology. The patient returned to her home country, thus the follow-up is currently under observation. However, I bring this case to the light due to its unique nature, as existing literature does not encompass the characteristics or management of the presented case. Thank you for considering my application for the U.S. Clerkships and Internships program. I am eager to contribute, learn, and grow within the STEAM medical community. Thank you very much. My name is Ramses.Vasquez.Pineda, and I Appreciate a lot that you consider my application. Thank you.